Dr. Raghav Tirupathi is Medical Director of Keystone Infectious Diseases and HIV. He's been practicing in the community for 9 years. He received his ID fellowship from UMDNJ. His interest includes HIV, AIDS, antibiotic stewardship, and infection prevention. He has received several honorary fellowships from the Royal College of Physicians in London, Infectious Diseases Society of America, and American College of Physicians. He has received several awards, including the National Award for Clinical Practice Innovation in 2020 from the Infectious Diseases Society of America, and he is playing a leading role in COVID-19 management and interventions at Keystone Health. So without further ado, here's Dr. Tirupathi.
Good morning, everybody. Happy Friday. I would like to thank United Way of Franklin County for giving me an opportunity to share my thoughts on COVID-19 as well as the vaccination drive that is going on right now. So we will go ahead with the presentation, and the focus of the presentation will be heavily on vaccines, and rightfully so at this time in the pandemic. We'll also review some of the statistics for international, national, and local level, and try to make sense of all of it. I would ask you to put your questions in the chat box, and we will go over it at the end of the presentation. Okay. So as we know, the COVID-19 pandemic has hunkered down the world over the last 1.5 years and has caused unmeasurable morbidity and mortality to countless families, not only in the US, but across the world. We saw our peak back in December and January. As you can see, the curve has trended down in the United States, and thankfully we are seeing the downward trend of the curve despite all of the other probables that could have made it much worse. On the other side of the world, the number of cases in countries like India, in Brazil, in South Africa, the cases have been steadily increasing, and India is in the midst of a second wave, and they are supposed to peak in about 2 weeks. I'm sure you have heard of it on the news, and it's causing a real havoc down there. So we need to be mindful of what's happening across the world. That's because what happens elsewhere today could happen with us tomorrow. So we always want to be mindful and be prepared and scale up our interventions as needed. The daily new deaths in the United States has also thankfully trended week by week. And this is a very welcome trend, which is, I think, mostly because of the vaccination drive. We have reached 100 million fully vaccinated American adults, which definitely has contributed to the curve trending down. However, we can definitely do better. There are countries like Israel and United Kingdom which saw peaks back in January and February. The green is UK, the magenta orange is Israel. So definitely you could see that they are having zero number of case positivity rate right now, at the end of April. So the states can definitely do better, and I think more vaccination will lead us there. So if you compare the other parameters, it's a little bit of a crowded slide, but the upper left-hand corner, the daily number of new cases in the United States is still above UK and Israel. The number of new deaths are also above Israel and UK. The number of patients requiring hospitalization, we are still above Israel and UK. And also the number of people who have got at least one dose of the vaccine, we are below UK and Israel. So as you can see, the relationship between the vaccine as well as how countries have fared with the different parameters, including deaths, hospitalizations, and new cases. Now, compare this on a global scale, right? The x-axis here is the number of people who have received at least one dose in percentages, and the y-axis is number of new deaths in the last 7 days. As the percentage of people who have got at least one dose of the vaccine increases, you see that the number of new deaths every day for the last 7 days decreases. The number of new deaths in Israel and UK is almost zero at this time. Compare that to US, where we are around 2+. So, but there are other countries which are faring very badly, as you can see, many of the South American countries. And one thing about COVID is it always comes in waves. So we should not become lax with what we're doing right now, only to learn from other countries' experiences and scale up our interventions as needed. So in this slide, you're going to see what is the percentage of the population that has received at least one dose of the vaccine. So Israel has about 58%, UK has about 51%, and US has about 43%. And see what happens to the cases per 100,000. When you reach that 58% mark, which is about 15 points above where we are right now, the number of cases dropped to 0.9, the hospitalizations dropped to 2, and deaths dropped to 0.03. So just going another 15% in the US might make us see all of these numbers here in the US and with respect to cases, hospitalizations, and deaths. So UK is somewhere in between. So this slide is just to impress on you what another 15% of the population getting vaccinated would do to the numbers. Now, the other question that comes up is the variants. There are different types of variants. In the United States, the surveillance for variants by whole genome sequencing and other methods show that the predominant variant right now is B.1.1.7. That would be the British variant. As you see, it's pretty much engulfed all of the other virus types. And that is the one that is circulating currently in the US in the week of 4/10/2021. I think it's much worse now if we look at the numbers at the end of April. So what this tells us is even with the variant being the predominant strain in the US, our vaccines are holding up, which tells us our vaccines are effective against B.1.1.7. Well, there are other strains, the South African strain, and that's the Brazilian strain, which is P1, which has limited data with respect to vaccine efficacy, and we'll have to see how we fare with the mRNA vaccines. Now, with respect to the different variants, as I said, 1.1.7 is predominant in the UK. The vaccines that have proven to work on these are AstraZeneca vaccine from the UK, the mRNA vaccines, Moderna, as well as the Pfizer vaccine. And this has been proven by lab studies, by bench studies, by randomized control trials, which is the most vigorous of the clinical trials that you can get, and real world evidence, that is the data from the real world after they have received FDA approval. So there are, however, gaps in certain areas. For example, we don't know if the Brazilian strain or the South African strain, the mRNA vaccines work really well in real world, but we know from lab studies and clinical trials that they do. Now we are seeing more variants, one from New York, one from California, which have limited data, but it's not the predominant strain as you saw previously in the previous slide. And the Indian strain, of course, is very new and concerning. So we don't have a lot of data there either. With respect to hospitalization by age group, here in the US, we pretty much focused our vaccination efforts initially on nursing homes, on elderly population about 60 or 65, depending on the state. And you see that because of that focus, the hospitalizations in the older age group has pretty much plummeted. What has that done is the younger demographics are now getting more affected by the virus, and they are being hospitalized at a higher rate compared to the older population. So something to watch out now that the vaccine is available for everyone, irrespective of the age. Hopefully those numbers would get better too. Coming down to Pennsylvania, we are seeing the same trend as the rest of the country. The number of cases have significantly trended down over the last few weeks, and that's a welcome trend, and we want to keep it that way. Coming down to Franklin County, Chambersburg Hospital, this data is from 2 days ago. It has about 15 patients admitted. It's a 285-bedded hospital. 5% of the patients are COVID-19. At one point, we had 30% plus. 234 deaths so far. And same with Waynesboro. 14 patients are admitted with COVID right now. It's a 56-bedded hospital. About 25% are with COVID-19, and they have about 18 deaths. Now, if you look at all of the trends of the WellSpan hospital system, I think York is the one that has seen the highest number of admissions, and Chambersburg is somewhere in between, the lower and the higher end. Overall, the Pennsylvania monitoring system dashboard shows that the numbers are all looking good, except for the new reported cases. Over the last 7 days, there has been a slight increase. The PCR positivity rate also has shown a slight increase. So these are numbers to be watched, but nothing really out of the ranges. A 14-day rolling average for Franklin County seems to have a downward trend. So this is in comparison to all of the neighboring counties in bold orange. So that is an encouraging trend that we would like to see. Same thing again in a different slide. Now, coming down to vaccines, what is a vaccine and how does it work? The vaccines prevent diseases which are dangerous and deadly, I should say the infectious diseases. They work with the body's natural immune defense system to safely develop protection from a disease by producing antibodies, just like when you're exposed to the disease, but you don't go through all of the ramifications of having the actual disease. Unlike most medicines which cure diseases, vaccines prevent it. And prevention is always better than cure. And I don't think there's a better example than COVID for that. What are the benefits of getting a COVID-19 vaccine? It would help keep you from getting sick. They have been shown to be very effective. Masking and social distancing decrease your chance of getting the virus or spreading it to others, but these alone are not enough. You have to think of it like a block of Swiss cheese. Each layer of Swiss cheese is an intervention, and the holes in each layer is not foolproof. So you have to have many layers lined up with each other to really have that complete barrier of protection. And vaccines are the strongest barrier there is. The more people get vaccinated, the faster we get back to normal lives. So what vaccines are currently available? There are 3 different vaccines. One is the Pfizer vaccine and a Moderna vaccine, which is the mRNA type of vaccines. The second type is the Johnson & Johnson vaccine. These are the 3 US approved vaccinations. All 3 approved vaccines are safe and highly effective. The Pfizer and Moderna vaccine require 2 doses, 3 or 4 weeks apart. People are considered fully vaccinated when they're beyond 2 weeks of the second dose, in case of a two-dose series. The Johnson & Johnson vaccine is only 1 dose. How do we know if the vaccine is safe? Vaccines go through a lot of testing and rigorous testing compared to other pharmaceuticals. There are different phases of the vaccine trials. In the first phase, small group of people receive the vaccine, and if it's proven to be effective and safe, it goes to the second group. Where it is given to specific groups of people with age, race, and physical health. And phase 3 trial is the biggest of all trials, where vaccines are given to tens and thousands of people to test for efficacy and safety. And once it passes this rigorous test, that is when the CDC's Advisory Committee on Immunization Practices vigorously looks at data. There is a fierce debate in those meetings. I've been to one of those. They're not pleasant, believe me. And based on that data, it gives a recommendation to the US FDA. US FDA has its own committee. It takes the advisory committee's advice, gels it up with their own committee's recommendations, and finally proceeds with either an emergency use authorization or with the full approval of the vaccine. Now, vaccines are only approved after all of these steps are done, and various teams of reviewers, as I suggested, are recommending it to be both safe as well as effective. It's a very democratic process. There is voting on each one of the components of recommendations before they are put out. Now, recently there have been concerns about the Johnson & Johnson vaccine. And this pretty much explains how the transparent process works. So there were concerns raised not only in the US, but also across the world, that it was Johnson & Johnson vaccine post-vaccination had caused a serious but a very rare blood clotting disorder where there was clotting of the veins of the brain, especially in young women. So based on that data, the FDA and CDC decided to hold off or pause the vaccination process until further review of data happens. The scientists at the FDA, CDC, the Advisory Committee of Immunization Practices, all of them did a rigorous review of the data. There was a major article published in one of the medical journals called JAMA with all of these data. Looking at all of the data, it was about 15 patients in about 8 or 9 million doses, which was less than 1 per million or 2 per million, which led the committee to believe that it is safe to restart this vaccination again, with certain warnings that maybe reproductive age women should not be getting this vaccine, or if they get it, there should be more observation of this cohort of patients. However, overall, the committee's conclusion were the benefits outweigh the small risk, because COVID itself can cause blood clots, and they can cause blood clots in the brain. And the likelihood of you getting COVID and getting a blood clot from that is much, much higher than from the vaccine itself. So this process and how it all played out shows that this is a very transparent process, and there is always checks and balances in the system where the CDC and FDA are closely monitoring for side effects, and they would be looking into any untoward incidents with the vaccine. Now, I frequently get questions, how is it safe if it happens so fast? Like why would a vaccine be approved in record time? My answer for that question is, it was not that corners were cut. It is just that there was an urgency to get a vaccine to save the world's population. So the mRNA technology is not a new technology as people believe it is. It has about 30 years of research behind it. It has been tested for other viruses, including HIV, Zika, Ebola in the past, but has now come to prime time with COVID virus, where there was the most success. So we had that benefit behind us. We also had very helpful information about coronaviruses beginning from the pandemic. Within 6 days of identification of the virus, there was a whole genome sequencing where the complete genome of the virus was mapped and published across the world for countries to work on the vaccine. This has never happened in the past. And thanks to the technology that this was able to be done this time around, that really sped up the process. Contrast that with HIV. For years, people didn't know what was causing AIDS until HIV was discovered, like in 1984 or 85, the virus itself. Number two, the other reason why it was so fast is the amount of money that went into these vaccine productions. Like many governments, including the US, invested a lot of money because it was a global pandemic and it was ravaging families across the globe. So there was a sense of emergency and urgency to get these vaccines approved. Usually, the amount of money that goes into vaccine is a few $1 million, but here it was billions. That was another reason why things could be sped up. Now, a lot of people voluntarily participated in clinical trials, and that also helped to speed up the process. And the fourth thing was the manufacturing happened at the same time as the safety studies were going on. Usually, the regular timeline is the research, initial development, testing, approvals, manufacturing, and delivery. So what happened with COVID-19 is manufacturing happened while testing and approvals were going on. And this was a gamble many of the companies made because of the assurance from several federal governments, not US and otherwise, that they would pay for the vaccine even if it is not working. So that's why companies were able to expedite things on multiple fronts, leading to a shortening of the timeline. So can I get COVID-19 from the vaccine itself is a question that I frequently get asked. No, you cannot get COVID-19 from the vaccine. That's because it does not have the live virus. The technology is an mRNA vaccine, which is a fragment of the protein making genetic material. So that would not cause COVID-19. Do COVID-19 have any side effects? Yes, they do. The most common side effects is tiredness or fatigue, headache, pain at the injection site, muscle or joint pain, chills, nausea, vomiting, or fevers. These side effects last for anywhere between 1 to 3 days for patients who will take it. And our experience has been it's about a day and people are able to recoup and go back to work on day number 3. Serious adverse effects have been very rare. Of the 100 million or so doses administered, the actual serious side effect of what we call anaphylaxis is less than about 75 patients. So that would be even less than 1 a million, which probably would be the risk of getting struck by a lightning or even less. So just to give you the sense of how many people participated in these trials, the Pfizer vaccine was tested on 43,000 people across US, Europe, South Africa, South America, and Turkey. Contrast this to other trials of vaccines. At the most, there would be 3,000 or 4,000 patients. So this was heavily and widely tested. And also, there has been some criticism about underrepresentation of minorities, both ethnic and racial, but that has been rectified in subsequent real-world studies. Same thing with Johnson & Johnson. The number of patients tested were about 43,000, and these trials took place in places where the variants were pretty prevalent, like Brazil and South Africa. And that helped us know the efficacy of the vaccine in the setting of the predominance of the variants. Moderna vaccine, again, involved about 30,000 patients, but here it was 18 years and older. And Pfizer is 16 years and older. The question about allergies, getting the COVID-19 vaccine. So the only situation where you should not get a COVID-19 vaccine if you have a history of serious allergies is only if you have an allergy to the ingredient in the vaccine. And the most common ingredient that people might report having allergy to is Miralax, that is a laxative that is also a component of the vaccine. The vaccine does not contain eggs, gelatin, preservatives, latex, mercury. They don't have any of those ingredients. Now, the ingredients is there for everybody to see on the FDA's website and also on the company's websites for Pfizer, Moderna, and Johnson & Johnson. If you have an allergic reaction to something else, you have to inform your healthcare provider, and they would be watching you for a longer time after vaccinations. Okay, I think I'm going back 1 minute. So if you have a history of a severe allergy, you will be watched for 30 minutes instead of 15 minutes following the vaccination. Okay, so this is another question which is being rightfully asked by women of reproductive age group. And I would like to clarify this question in more detail. So people ask me, does it have any impact on their fertility? If they want to have a child someday, is it safe for them to get COVID-19 vaccine? So people who are trying to get pregnant now or who plan to try it in the future should and must receive the COVID-19 vaccine when it becomes available to them. This is especially true for folks who are in situations where they're more exposed to COVID-19, like frontline essential workers, grocery store employees, wherever there is interaction with people. Based on what we know right now, and CDC regularly releases data with respect to pregnancy, breastfeeding, and lactation with COVID vaccine, there is literally nothing to suggest that COVID-19 vaccine causes infertility, abortions, preterm births, or bad pregnancy or post-pregnancy outcomes. So absolutely, there is no evidence that it has any problems with fertility, pregnancy, or breastfeeding. We all know someone who is having this concern. So I would like to reassure you, and also you to reassure them, to tell them that there is not a lot of data for that fear. So again, this is a personal choice, we understand. And if you're concerned, you should be talking to your OBGYN or your healthcare provider. The American College of Obstetricians and Gynecologists, which is the flagship organization for OBGYNs, recommend that COVID-19 vaccine be offered to pregnant and breastfeeding individuals when they're eligible and should be provided to those patients. Why do they say that? Because we don't have much data to suggest otherwise, that it has bad pregnancy or breastfeeding outcomes. And also we do know that if you do get COVID-19 during pregnancy, there is increased risk of severe illness and bad outcomes, including preterm birth. So getting COVID itself could be 10 times much worse during pregnancy. Are COVID-19 vaccines safe for children? The Pfizer vaccine is authorized for 16 years and older. Moderna and Johnson & Johnson authorized for 18 and older. Younger children and adolescents are not yet authorized to get the COVID-19 vaccine, but as we speak, the FDA has data from Pfizer for 12 to 15 age group. They're going to be looking into the data with the same process as I mentioned previously, the ACIP, the FDA's advisory committee, the Data Safety Monitoring Board. They will all be looking at that data and making some recommendations next week. This is another question I always get. Will COVID-19 vaccine change my DNA? No, they do not change your DNA. I think this question is specifically for the mRNA vaccines. The mRNA from the COVID-19 vaccine does not enter your nucleus where your DNA is housed. So the mRNA enters into the cytoplasm of your nucleus, which is the outside of the cell, and it prepares the spike protein, which is the virus protein. The protein gets expressed on your cells and the body mounts an immune response to that. The cytoplasm then destroys the mRNA, so there would be no sign of it. So no, they do not cause any problems with your DNA. They do not alter your genetic code. How were decisions made to prioritize vaccine? I think the decisions are based on ethics, where the priority was given to preserving the health system, where healthcare employees were preferred in the beginning. We also wanted to limit severe sickness and death, and the obvious choice for initial 1A tier was our elderly. And also there was a good amount of weightage given to promote equity, because we know that our racial and ethnic minorities have bear the brunt of the pandemic because of various reasons, including inability to socially distance, inability to call off work, and many other factors. Now, where can I get the COVID-19 vaccine? We all know that all of our adults in Pennsylvania are eligible from April 19, 16 and above. Adolescents from 12 to 15 in the next 1 week could also get emergency use authorization for the Pfizer vaccine. In Pennsylvania, there is a website on the PADOH official website. There is a link to get yourself registered. And there are also phone numbers being set up by local organizations, including WellSpan and Keystone, to be called if you're a little bit internet challenged. what if I need help to getting around to a vaccination site? I understand that Rapid Transit is offering free shared ride transportation to any community member who needs support for transportation to and from the site of vaccination. Will I have to pay for the vaccine? No, the vaccine is free for all PA residents. You will not be asked for a credit card number. You can get it even without an ID card. Will an immigration status affect your ability to get the vaccine? No, getting the vaccine is irrespective of immigration status because this is a public health issue. What should I do if I experience symptoms after receiving the COVID-19 vaccine? CDC has established a passive surveillance system called vSafe. It's a very nice app. I encourage all of you to download it if you're getting your vaccination in the near future. vSafe asks you to methodically document your symptoms on day 1, 2, and 3. And also if you develop any serious effects, you can document that. And if there are concerning side effects, the doctors from CDC will be contacting you. And I have had several patients who used the app and found it really helpful in terms of informing themselves about the possible side effects and where an alarm needs to be raised. How long does it take after the COVID-19 vaccine to be effective, and how long does it last? So the answer here is, if it is a 2-dose series, it has to be 2 weeks after the second dose when you will be considered fully vaccinated and protected. Now, if it is a 1-dose vaccine like Johnson & Johnson vaccine, it would be 2 weeks from the 1 dose. How long will it provide protection? We don't know the answer yet because we need multi-year data to say it's effective for a longer duration, but several modeling studies and studies from the trials itself are predicting immunity for up to 2 years. So the next question people ask is there a role for a booster here? Because of the durability issues. And I would answer that saying that CDC is looking at the data, both for coverage for variants and also for the durability of the vaccine. As of now, there is no official recommendation for the booster, but the companies are scaling up production of the boosters just in case, because we don't want to be caught off-handed. So eventually, if there is role for a booster, there will be guidelines released. So as so far, no official recommendation. This is the next question I always get. Do I need to continue wearing a mask if you're fully vaccinated? Now, wearing a mask has been a graded response from the CDC. They have now taken away the requirement for masking if you are fully vaccinated, which is 2 weeks from the second dose of the 2-dose series or from 1 dose of the 1-dose series. In outdoors, you could take your mask off, but if you're in a crowded setting in outdoors, you still need to wear your mask. And if you're indoors, it's preferred that if it is crowded setting, you mask. So it's a little bit of a sophisticated decision making, but it's always better to mask and err on the side of masking because we don't know what is happening with the variants. However, if you're just taking a jog and walking outdoors and attending a small gathering of people who are fully vaccinated or even unvaccinated, you're allowed to go without a mask. So this is a nice slide telling you what you need to do in different situations. The gist of this is pretty much outdoors, you can go unmasked for most of it, except in a crowded situation. But indoors, you would be erring on the side of masking. The other advantage of having the vaccine is quarantine after vaccination. So vaccinated persons who get exposed to someone with COVID-19, either at home or at work, do not need to quarantine. Unless they have symptoms. So you have to be fully vaccinated and should not have any symptoms, and you can go about your work as every other day, any other day, except if you are having symptoms. So that's a lot of days saved from loss of work and pay. There are a few things you want to in summary, remember, keep wearing a mask in situations where social distancing is not possible. You could still get COVID-19 following the vaccination because some of the variants have demonstrated some immune escape, but the severity will not be bad. Instead of ending up in the hospital on a ventilator or dying, you might get a pesky cold. You could still infect someone else because people have had asymptomatic infection following the vaccine. So you want to be mindful of that. You can visit family and friends if the other group is vaccinated in small groups, of course. You always want to keep your vaccine card because that might be proof of documentation for vaccination for different purposes. Traveling is still a little bit iffy. So I think these recommendations will change as more and more people get vaccinated. You can schedule your doctor and dentist appointments. As we discussed, you may need a booster, and eventually we want to achieve a state of herd immunity with all of these vaccination efforts. So these are some other things that you can do. The best thing about being vaccinated is if you travel domestically, you don't have to test before and after travel or self-quarantine after travel. As you can remember, there was a time when people traveling between states were asked to quarantine after they reached their destination. So that is no longer relevant if you have got your vaccine, and also quarantine following exposure. Now, again, these are several layered decision making with respect to vaccination. You always want to talk to your trusted healthcare provider. It could be a physician, it could be APP, it could be a nurse, it could be your insurance care manager, your local pharmacist, or a community health worker. So talk to people who know about the vaccine, get your trusted information from trusted sources. There's a lot of information on the internet. All of that is not credible. You want to get it from credible sources, and always ask questions if you're not sure. So with respect to myths and facts, the vaccine was rushed and isn't safe. No, it was not rushed, as we talked about it. No corners were cut. The vaccine changes your DNA. No, it does not change your DNA or interact with your DNA in any way. The vaccine can give you COVID-19. No, it cannot give you COVID-19. It does not have the live virus. It can cause serious adverse effects. No, we know from data so far that serious adverse effects is very, very, very rare. And last thing, it does not cause infertility. What we know is they're effective in preventing COVID-19 disease, and prevention steps help stop the spread of COVID-19, but we're still learning how effective this vaccine is for different variants and how well vaccines keep people from spreading the disease and how long can it protect, that is the durability. So there are credible resources, namely the CDC's website and community-based organization toolkit that you could use in United Way to disseminate information on COVID-19. At the end, I'm going to say, do all the right things with respect to COVID-19. This disease has taken too many lives unnecessarily. We are almost there, and I think it's a collective responsibility to get us out of this mess. And vaccinations are the most important piece of the puzzle here. Thank you very much. I'll be happy to take questions.